I'm going to introduce myself, and then I'll hand it off to our Executive Director. I am Sunita Mutha, and it is my great pleasure to say good morning and to welcome you to the 28th Annual ITUP Conference. So please join me in recognizing the board. Now, please join me and give it up for Crispin Delgado, who's the Executive Director for ITUP.
Good morning, everyone. I can't hear you. Good morning, everyone. Yeah, I hope that coffee's kicking in. Yeah, it's 8:30, 9 o'clock now. Yeah, wake up. I need to wake up. It's great to be here. It's great to see so many familiar faces out there, many new ones. I can't believe it's been 10 months since we were together last. Last March, I was announced as the new executive director. And so since then, I've put my head down and really got to work. And it's been an incredible 10 months. You know, I filled my time really with trying to connect with as many people in our network, if you will. And just learning. And, you know, a part of that I am uplifting is listening, number one. You just learn so much more when you listen and not listen to react. And so that's been really wonderful for me to hear what are the greatest needs of our community and how we could really harness ITUP's resources to meet those needs. I've also felt the sense of speaking up, right? Bringing voice and light to a lot of issues and making them human issues. And lastly, you know, there's a hunger to act. So not just listening to people and writing down what they say, but, you know, also taking that to our state policymakers, making sure that we're making connections between state policy, state-driven policy, and local implementation, because that's really where patients experience the healthcare systems. Today's event showcases the innovative, actionable, forward-thinking leaders and work that California is known for. And while we're highlighting the work that still needs to be done, to truly create a healthcare system that works for the diverse communities and individuals across the state. I would like to take this opportunity to thank the ITUP staff for putting this together. So we could give them a round of applause, please. Yes. Everyone on the team, this is an all-hands effort. And they have put sweat and tears and everything into this planning for this event. So thank you for being here. And I just want to recognize each and every one of you for being a great team. I'm excited to jump into today's content. But before I begin, I want to give an extra welcome to first-time ITUP attendees. Conference attendees, in a second, I'll provide you a little bit more information about ITUP, but can I hear from people that are here for the first time? Can you clap or show yourselves? Oh, wow. Okay. I know that we have a number of students that are here, which I consider the next generation of health leaders. Can we hear from the students? Don't be shy. Don't be shy. Okay. How about our community health center partners? Yes. Proudly. Our hospital partners. Yes. Thank you. That's the hospital energy I like. Nonprofit organizations that are here. Yes. I'm also a nonprofit, so yes to that. Other community partners. Yes. Thank you. Yeah, and any government folks here? Okay, great. So as you can see, there's definitely diversity in our audience, and I really encourage you, especially if you see a person that's here for the first time, to introduce yourself. And I encourage the first-timers also. There's so much expertise in this room that I also encourage you to reach out and meet people. And not to mention, we have the cool app that if you're really shy, you could first message people on the app. I'll tell you how it works in a bit. So ITUP has been around for 28 years, and it is considered a nonprofit policy convener. ITUP, we have 3 areas of focus, which is coverage and access. And so this is in keeping in line with our original mission of ensuring the uninsured. Secondly, delivery system transformation. And lastly, focusing on the future of health. So a lot of work that we've done in the past few years has really focused on broadband access as a means to get people onto telehealth and other technology. The mission of ITUP, let me make sure I'm on the right screen here. Okay. The mission of ITUP is to promote innovative and workable policy solutions that expand healthcare access and improve the health of all Californians. Let me go to slide 4. ITUP implements its mission through policy-focused research and broad-based stakeholder engagement. ITUP believes that all Californians should have the fair opportunity to live their healthiest lives. We seek a health system that is universal, equitable, accessible, effective, and affordable. So it's a nice little list of what we're expecting. And so going on to my next slide, in addition to this annual conference, we also run more than a dozen policy and regional work groups across the state and produce in-depth issue briefs and high-level fact sheets, a few of which are showcased on this slide. And then you can also find everything in the app, which I'll talk about soon. As an independent nonprofit organization, so here are some of the additional resources that we have, and they should all be in the app. I just want to make it clear that, as an independent nonprofit organization, all the views that you'll hear today are our own, or the speaker representing themselves. So just wanted to mention that. And then I want to highlight our core support funders. So we are primarily funded through core support by the California Endowment, the California Wellness Foundation, and California Healthcare Foundation. So thank you to all of you. I see some of the program officers out there. Thank you for being here, and thank you for supporting us in this work. Next, I'd like to also thank our generous sponsors, especially our platinum sponsor this year, Blue Shield of California Promise Health Plan. We are incredibly grateful for your support of our work and this event. The next group of folks is we also want to acknowledge our other valued sponsors, especially our gold sponsors. This year, Anthem Blue Cross and Kaiser Permanente, without whom this conference would not be possible. We encourage you to visit the sponsor booths that are outside, set up in the lobby during the breaks and throughout the conference to connect with those that have supported this event. I mentioned it yesterday at the Peak Conference, but there's some pretty good swag out there, so just make sure you go and collect your cups and everything. I think that there's also a game on the app, which I'll get to in a second. Now for a few reminders, please turn off your cell phones or put them on silent. You can access the complimentary Wi-Fi with a really creative password, which is just ITUP 2024. It should be easy to remember. And I encourage you to sign up for that just because we'll have messaging on the app and ways for you to connect, and I'll highlight a couple more examples of what we can do. Let me move to the next slide. And so this conference app, which is, you see, it's called Cvent app. You can find it in whatever marketplace you download your apps in. And then you simply sign in by using your name and your registered email, and you should get in. Like I mentioned, our agenda is on there. There's also the opportunity to connect with other people at the conference. If you don't have a picture in there, I encourage you to take a selfie and update it. It's easier to remember faces if you're connected. And really engage with the app. You know, we tried to put as many resources as possible in it. This year, we also are featuring instant messaging on the app. So if you want to relive your texting days, I would encourage you to engage in this way as well. And we do have a virtual challenge, which is in the app. It is meant for you to engage with our content and other people. And the winner at the end of the day will receive an Apple Watch. So I hope that you all participate in that. So let me talk to you a little bit about today's agenda. So we have a very full agenda for today, which I'm very excited about. Which, you know, like I mentioned, you can see it on the app, our agenda for the full day. But today's events are being kicked off with a special performance, followed by remarks from two of California's health champions and a form of artistic and cultural expression. Let me make sure I'm on the right page. That didn't sound right. So, you know, we're gonna start off with the healthcare champions and a conversation with statewide leaders to discuss efforts in creating an anti-racist, community-driven workforce. This afternoon, we will continue having a great innovative discussion with 2 rounds of thought-provoking breakout sessions that dive deeper into the pressing healthcare issues and emerging issues to better serve Californian communities. We must center healthcare innovation and change around individual and community needs by asking ourselves, are we actually making healthcare better, more accessible, and equitable, and for whom? So the first round of breakout sessions brings unique perspectives for reaching older adults, the justice-involved populations, and building an equitable workforce. You also don't want to miss the second round of breakout sessions, tackling the crucial barriers to quality, accessible, and equitable healthcare, specifically addressing social determinants of health. Be sure to stick around until the end of the agenda today to tune into a new type of ITUP conversation between leaders on the relationship between democracy and its impact on healthcare delivery. So I'm running that panel later today, one of our closing panels, and I'm really excited about that, and I hope you stay around to listen to it. There was a lot of intentionality put into creating this agenda. We wanted to highlight our core values while also folding in what we see as an opportunity to advance health equity. To me, this means listening to our communities, an idea which birthed the title of our conference. Over the last 2 decades, I learned that listening is at the heart of being a good partner and a good leader. By listening and including community voices, the conversation opens up to new possibilities, innovative ideas, and community-driven solutions. I recognize that communities themselves understand what is most needed and for us to improve access to quality, equitable care. So speaking of bringing in new voices, this year we made another change. We are bringing a Sacramento-based cultural group to welcome all of you to our convening. This is really meant to ground us in the indigenous roots of the land that we're sitting at. This land originally belonged to the Nisenan, Maidu, Miwok, and Miwok peoples. And so since we couldn't get a representative from those communities, I'm humbled that we could bring another local group that will welcome all of us as well as the ancestors of this land. So with that, it is my pleasure to introduce Carmen Koch de Casa de Raíces, a pre-Columbian Aztec dance organization committed to providing its community with the opportunity to learn and experience the culture and traditions of their ancestors through danza, drumming, and other forms of artistic and cultural expression. We hope you enjoy this performance, so thank you.